In 1974, in a room above a grocery store, 4 medical students set out to create a safe, judgment-free place where LGBTQ folks could access healthcare without fear. By the 1980s, Howard Brown Health became a national leader with its response to the AIDS epidemic by providing medical care, launching a 24-hour hotline, and mobilizing community support when it was needed most. They opened the Brown Elephant resale shop to fund services for uninsured patients and staff the hotline with volunteers. To this day, Howard Brown Health offers discounted sliding scale fees for folks who are uninsured or low income. No one is turned away for lack of funds. From 4 med students to 7 fully staffed locations across Chicago, Howard Brown Health offers comprehensive services from primary care to mental health and dentistry. Staying true to their roots, they specialize in LGBTQ+ healthcare, including HIV treatment and prevention, therapy, and gender-affirming care.
But what makes Howard Brown Health different isn't just what they offer. It's how they support their patients and see them for who they are. Physician Dr. Magda Holberg, a geriatrician at Howard Brown Health who mentored an OTD Capstone student, embodies that approach. She specializes in HIV-positive care and provides home visits for patients who cannot make it into the clinic, meeting them where they are, literally and figuratively. She sees beyond stereotypes like the rich gay uncle. She sees artists who supported their work with restaurant jobs but don't have Social Security or retirement benefits. People pushed into caregiver roles by family because their lifestyle isn't assumed to have as many responsibilities. Couples whose relationship isn't acknowledged by family or the legal system. Dr. Holberg mentioned that she frequently focuses on medication because the population she works with has higher rates of chronic illness. Medication management is crucial for older adults and LGBTQ+ patients, but they need more. Patients trust her with their medical care, but she can't ensure outside service providers will be able to give them the same quality and compassionate care they receive at Howard Brown Health. While physicians focus on diagnosis and medication, occupational therapists focus on daily life. How do you manage your medications? What happens when pain makes it hard to move? What barriers are keeping you from functioning day to day?
During his Capstone experience, Kenny Lee understood the need to provide the affirming care patients expect from Howard Brown Health. As the only one with occupational therapy training, Kenny was able to help patients and providers address the gaps in primary health care. While he noted this as a challenge, as there are no OTs at Howard Brown Health to follow, he said it was a fantastic opportunity to establish leadership and self-advocacy skills. Having one-on-one time with patients in the clinic, assess needs on varying levels, and develop a research project specific to a population he deeply cares for. Kenny's Capstone research addressed the 4 M's, an aging-friendly healthcare framework, asking what barriers to mentation, medication, mobility, and what matters exist for the older adults he and Dr. Holberg worked with. In a typical day, he would greet patients in the waiting room, assess their need with conversation and informal OT measures, then relay patient requests and his own recommendations to Dr. Holberg. He highly recommends Howard Brown Health as a Capstone site. He describes his day-to-day as the perfect balance of patient care and strong mentorship. Part of his daily routines included providing fall risk assessments and learning about medications and chronic illness awareness. He also implemented low-cost interventions like using KT tape. Kenny also experienced some challenges. He wanted to incorporate data on gender identity and sexual orientation, but ran into barriers placed by anti-trans legislation and lack of funding. He feels confident that Howard Brown Health has the potential to incorporate OT into their services with strong advocacy and data, as well as a willingness to find grant funding.
For future OTD students, Howard Brown provides a unique opportunity to work alongside an established and well-respected LGBTQ+ healthcare institution in a primary care setting. Being able to work with an interdisciplinary team who are passionate about providing comprehensive healthcare is a golden opportunity. It's important as future practitioners, we gain a holistic and diverse understanding of the LGBTQ+ community whose history is ever evolving, as are their unique healthcare needs. To learn more about Howard Brown Health's mission, current anti-trans legislation, and research on OT and primary care, please visit the following QR code resources.